Once again, I'll just get started. My name is Ramki. I'm a therapist at RVA Physical Therapist. Once again, the purpose of Weekend Wellness is to at least utilize this time that we are all quarantined or stay at home to learn more new things. And what we are trying to do here is to bring in speakers from different parts of this country and also around the world, whoever is available to present on different topics. And having said that, today's topic is on health and immune function. Um, James George, Dr. James George is a good friend of mine. He was actually my clinical instructor when I did my bachelor's in India. He has done his bachelor's in India in Madras Medical College, and he has done his doctorate in Loma Linda University, where me and James did our master's together. And once again, like I said, he was my clinical instructor, a good friend, and he has done his, diploma in homeopathy from International Association of Classical Homeopath Institute. And he's going to talk on one of the important topics today, like, importance of, keeping your health at the pristine level right now with COVID going around, and also how to improve your immunity. James George, here you go. I'm going to make you the presenter and we'll go from there.
Hi. Good afternoon, everyone. This is Dr. James George. Thank you, Dr. Ramki, for this opportunity. Above all, we want to share the rich information we have learned. What's all about learning, but if you cannot share, right? That's what is important. So let's go ahead with the presentation. Thank you all for coming online. I hope you're keeping yourself safe and hope your family is also safe. That's all we want. All right. So right now we have is healthcare versus healthcare. What we are looking at is we don't want healthcare anymore. We want healthcare. We want positive things. We want to look at what can be done so that people can be helped and give hope. So I'm going to present with facts as much as what I have learned from different courses, and because of the facts, we are going to make informed decision, and that gives us hope. Now, I want to also give you some important information about more than 80% of infected people. That's a recent study have recovered without any special treatment. So, so that is a great hope. So don't be panicked. Be positive. Try and follow the guidelines given by the medical authorities, and also keep yourself safe. So let's talk about what's going on here. Why is this novel coronavirus causing this havoc compared to any other virus? Yes, we do have flu. People do get infected by flu every year, and some people die because of that. But here we see a pandemic all over the world. The reason is we do not have antibodies to the novel coronavirus. In fact, the novel coronavirus is a mutated virus, cold virus actually. So because it is mutated, its genome is different, and our body is not able to recognize it. Now, why is the coronavirus attacking us? Basically, it wants to find a host and proliferate and grow. It wants to eat, just like how we want to eat and proliferate. That's what it is trying to do. Now, so as we don't have antibodies, and they are trying to prepare a vaccine, we don't have vaccine right now for it, but hopefully in the future. Now, that's where your passive and active immunity comes. When you take vaccination, your passive immunity comes. But when somebody is exposed to this virus, you get active immunity. Now, there is also called innate and acquired immunity, where, from your parents, from when you were born, you get the immunity from your parents to what they are exposed to. And we get acquired immunity by when we, as children, when we play out in the dirt, right? You get exposed to so many viruses, bacteria, and everything, and then you develop the immunity. Now, you don't have immunity for this virus because it is a new genome. It's a new genomic sequence. Your body is not able to recognize it. Now, I want to give an example. We, we have trillions and trillions of bacteria, viruses, and other microbes living in our body. Many of them are good viruses, some of them are bad. Actually, for example, people who have had chickenpox, as as they grow older, they end up in having cold sores. Especially, we found there's research backup saying that people who end up in stress or having a poor immune system or the immune system has gone down, they end up in cold sores. So this chickenpox virus has been in your dormant, I would say, was staying dormant in your body, but it got activated when your immune system went down. And that's how cold sores happen. Similar to that, all the viruses you're exposed to or the microbes you're exposed to, they are living in an ecosystem in your body. So when your immune system goes down, you are more prone for infection. Same with many of the bacterial infections you exposed to growing up. When your immune system goes down, those bacteria can come up and start infecting you. You don't need to actually get exposed from outside. Many people do, but there is a chance you could also get it from your own body, which they are living dormant in you. Now, here, the COVID-19 virus is an RNA virus. Now, RNA is a ribonucleic acid. And that is why, same with influenza virus, it's an RNA virus. They kind of mutate and change almost every year. That's why you need a new vaccine for flu every year. So that could be one of the scenario here too, as they develop a vaccination for this year. I'm just throwing it out there. It's my opinion. You may need another one the next year. So, hey, are we going to be closing down everything every year? The best thing is we need to actually control our body. We don't know what next year holds or the year after. The onus lies upon us to keep our body strong by improving our immune system here. It is hard to control the COVID-19 infection. So you can control the host, which is us, by improving the immune function, right? So who are more prone for microbial infections? Right now, they have done research and found that the people with these diagnoses, cardiovascular diseases, diabetes, obesity, hypertension, age greater than 50, chronic pulmonary diseases, chronic liver or kidney disease, cancer or radiation therapy, undergoing radiation therapy, people with autoimmune conditions, chronic neurological diseases, and organ transplant recipient on immunosuppressive drugs, they are more prone for COVID-19 or any other microbial infection. So these people have to follow CDC guidelines strictly, very strictly, to keep themselves safe. That doesn't mean that all others shouldn't be, but I'm just throwing it out. So you should be very careful if you have such diagnosis. Now, statistics says that about 78% of patients in the ICU due to this COVID-19 pandemic and 71% of patients hospitalized had three main health conditions: heart disease, diabetes, and chronic lung disease. What do we see here? So like heart disease and diabetes, there is ischemia. There's the tissues are not getting enough oxygen, tissues are not getting enough nutrition, there is not enough blood supply. So that causes, there's a term called infarction, which is dead tissue. Now, we know that the microbes, bacteria, the virus, protozoa, all of these stuff, they actually feed on dead tissue. So what the onus lies upon us to improve our immune function, not only that, to keep our cells in our body alive and active. So that is what the following slides I'm going to talk more about. Now, before that, I want to give some symptoms of COVID-19. Many of us know this: fever, dry cough, fatigue, muscle or body pain, sore throat, shortness of breath, diarrhea, loss of smell, loss of taste, dizziness or headache. Now, what the current recommendation is, if you have shortness of breath, you have to go to the hospital. But if you have any other symptoms, they say, quarantine yourself, protect others from you, and keep others safe. And that's what the current recommendations. But shortness of breath, go to the ER or the urgent care immediately. Now, the healthcare guidelines, we all know this: hand washing for greater than 20 seconds here. All right. Um, and then alcohol-based sanitizer, 60% to 95% ethanol, wear mask, physical distancing, and COVID-19 enter our bodies, our homes, unless we let it in. So basically, you need to follow these guidelines so that you don't let them into your body, all right? Why does this COVID-19 spread easily than other ones? They can be viable on certain surfaces for up to 72 hours. Steel and plastic, actually, the virus is kind of viable for 72 hours, and on cardboard for about 24 hours, and in the air for 3 hours. So basically, anybody who was infected with COVID-19, it can be viable in the air for about 3 hours. And our shoes, it can be viable for 12 hours. So you never know where you have walked into, especially healthcare practitioners. You work in the hospital, you need to leave your shoes outside the home. Do not bring it inside. And why is it easy to spread? This particular COVID-19 has a spike protein surface on the virus, and it actually binds to the host really stronger. So it actually tries to proliferate faster. And they say about within hours they can create 10,000 of viruses within few hours. So now, why are people ending up in severe illnesses? Because our body doesn't have antibodies, we produce what is called cytokines. The cytokines are tiny proteins which are produced by almost all cells in our body, which trigger the immune system. This triggering of immune system causes inflammation. And when this inflammation is not controlled, it causes cytokine storm. Now, with cytokine storm, what happens is, yes, it is a good thing. Cytokines are a good thing, but the storm is not good. The reason is not only this inflammation affects our kills the viruses, but it can also go and attack our own immune system, attack our own normal cells in the body. And that is how people end up having lung fibrosis, like, and end up in even serious, even death. Yeah. So let's look into microbes and what, as far as we know, bacteria, viruses, fungi, protozoa, amoeba, these are all the microbes. But our immune system, it consists of white blood cells, complement system called the cytokines, which I discussed, and then the antibodies, which are also the immunoglobulins, IgA, IgD, IgE, IgG, IgM. In the lymphatic system, the spleen, the thymus, and the bone marrow. All of these guys work to fight against the bacteria, the viruses, fungi, and protozoa, and the amoeba. Now, for me, as we all know, such novel coronavirus, we don't have vaccine, we don't have medicines for that. So we need to improve our immune system, this system, to fight these. Now, what to avoid? We need to avoid processed foods, sugar, gluten. For many people who are allergic to gluten, that could cause them to be more prone for the viral infection. Foods you are allergic to. So you need to know which foods you're allergic to. Many people know that. When you eat certain foods, you have diarrhea, you sneeze, you have some hives. So try to avoid them, especially this time. And also the medical doctors say try to avoid non-steroidal anti-inflammatory drugs, because it actually, the normal inflammation which actually kills the virus, you're actually stopping it. So you are more prone for infection. Now, here comes where the specialty has studied homeopathy. Now, we have found homeopathy is an immune modulator. So if you could put an immune system on a scale of 1 to 10, 1, so 0, I'm putting 1 for you guys to see, 1 to 10, all right? So 1 to 3 is like low immune function. People are more prone for infection, cancer, etc. But 4 to 7 is optimal immune function. Now, 8 to 10 is hyperactive immune function. That's when people end up having allergies and anaphylactic shock, right? There are 3 laws of principles of homeopathy. The law of similars. like cures like Similia similibus curantur. Uh, Here we take like a plant-based and mineral-based material, sometimes animal-based material, we actually diluted. The pharmaceutical companies, especially there are many in the US and Europe and many in India and all parts of the world. It is homeopathy is second most used medical system in the world. So they actually dilute these plant-based and mineral-based substances, and they have done research that certain of these plant-based stuff, they produce symptoms which can be matched to the symptoms produced by the human beings. When the correct remedy is given, these symptoms are actually alleviated. Actually, these people get better. The patients get better. So the second law is the law of single remedy. We find the correct remedy which matches the symptoms to the patient with the symptoms of upper respiratory tract infection or any other illnesses. And once that remedy is given, it heals the patient. The law of minimum dose, as I said, it's similar to nanomedicine. The medicine is diluted to the point so many times and suffused, shaken, that there is no toxicity to these homeopathic remedies, and many of them are over the counter. Now, if you research evidence base for homeopathy, there are systematic reviews done on randomized controlled trials of homeopathy. If you send me an email, I can send you the link to these RCTs and the systematic reviews. But I have highlighted here, they found positive conclusive results for upper respiratory tract infection. I call homeopathy kind of a preventive measure because when people end up in have upper respiratory tract infection, especially with the viral infection, there is a chance when the immune function is low, they can end up in pneumonia or lung issues. So when homeopathy is given right away, you can avoid this. And there are a lot of research which has shown positive conclusion for these other diagnoses like childhood diarrhea, postoperative ileus, paralysis of bowels after surgery, rheumatic diseases, seasonal allergic rhinitis, vertigo, influenza, insomnia, sinusitis, bronchitis, chronic fatigue syndrome, fibromyalgia, premenstrual syndrome. Now, I am part of several groups of medical who practice homeopathic doctors. They have come up with certain remedies. These remedies have helped, but you may note this down. One of these remedies would work for somebody who has got this upper respiratory tract infection or even diagnosed with COVID-19. But what is important is you need to consult with the homeopathic practitioner because what the right remedy needs. So you need to talk to the homeopathic doctor and tell them your symptoms, and they will tell you which remedy to take. So currently, these remedies have helped patients to recover from these viral infections. Now, nutrigenomics. I am wearing my functional medicine practitioner hat here. So chopped vegetables, when you chop them and leave them for a day or two in the refrigerator and you eat them raw or cooked, it is known to improve your immune function. So what it does is, we all know when we have a cut injury, we produce healing cytokines there, and in few days it heals. Same like that, the vegetables also produce healing properties when you chop them. So they secrete this healing, we call the enzymes. When you consume them after a day or two, you are consuming the healing enzymes, and that helps you improve your immune function. Now, citrus fruits, vitamin C is found to help improve your immune function. Many of us know that. Then roots vegetables like sweet potatoes, carrots, beetroots, all of these, and green leafy vegetables, they all have vitamin A. Those are also helpful to improve immune function. Then sunshine and mushrooms, they are loaded with vitamin D, and they are helpful in improving immune function. And then berries have a lot of antioxidants. nuts and seeds, soup, warm soups, herbals and spices. Like I'm originally from India, so we add a lot of spices and herbs in our food. But many people do not do that because of especially in the western part of the world. It is good to start using these. There is a lot of research backing up that it helps improve the immune function, and many of those have anti-inflammatory properties. Fish is a good protein. You want to have those fish, helps improve your immune function. And then probiotics, and then zinc citrate. The recommendation is at least 50 mg 3 times per week. You don't want to overdose on that. Just take 3 times per week is pretty good. Same with selenium, 200 millicentigram 3 times per week. So proper diet enhances your immunity. Poor diet impairs your immunity. Now, coconut oil is found to help actually break the capsid of the virus. And what it does is there is a compound called monolaurin. So when you take like half a teaspoon of coconut oil and apply it on your tongue and let it, go up to your throat, and you swish it in your throat, and you can even swallow it because it's only half a teaspoon. Many people don't like the taste. You can spit it out. But what it does is, if you have sore throat, using this can help actually kind of killing the virus, basically. It breaks the outer covering, the protein of the virus. Now, exercise. I'm wearing my physical therapist hat. You need to, go to a physical therapist or a physical trainer. You need to exercise, or you can right now, because of the lockdown, you can watch videos and perform exercise for at least 30 minutes per day. The rate of perceived exertion to be 5 out of 10. 10 is something, 10 out of 10 is you are running a marathon, and that's really 10 out of 10. And so you need to feel like at least 5 out of 10, you have worked out, you're breathing hard, so exercising for at least 5 days per week would be helpful to improve your immune function. And then impulsive breathing exercises, which means that you breathe in through your nose and you purse your lips and breathe out through your mouth. You're kind of decreasing your respiratory rate. So the normal respiratory rate is 16 to 20 rates per minute. You want to bring it down to about 10. So basically, you breathe in through your nose, and if you're breathing in through your nose for about 3 seconds, you want to breathe out through your mouth for 6 seconds. So kind of you're decreasing your respiratory rate. That is also known to, as I discussed earlier, remember the virus is looking for a host to proliferate, and it likes tissues which do not have enough nutrition and enough immune function and enough oxygen. So when you do deep breathing exercises, you are improving the oxygenation to the tissue, and you're keeping all your tissues alive. And when there are less dead tissue in you, you're not letting the virus to grow. Sleep, and sleeping for at least 7 hours is very important. And many people do not do that. There is research backup for this. If you want, you can send me an email. I will send you the links for that. So if you have hard time sleeping, try melatonin 3 to 5 milligrams in the evening, at night. So basically, it can help you go to sleep. But you need to try and get you 7 hours of sleep. And sleeplessness, many people have. I have seen many of my patients who have issues of, especially business owners, and especially like job loss. They see that they are not able to go to sleep because they have persistent thoughts going on. What would I do about my business? What would I do about things happening with my life? I have lost my job. I have issues at home. And such people, homeopathy can help actually to help improve their sleep. Try melatonin. If it is not helping, you need to consult with the homeopathic doctor. And also, many people have seen like having hyperactive bladder. They have to go to the bathroom every 2 hours, and we have found that homeopathy can help for them as well. So if you do not have 4 hours of REM sleep and 3 hours of non-REM sleep, you're at high risk of infection and autoimmune diseases. So thank you. If you have any questions, feel free. This is the time for you to ask. I hope I kept it short and sweet. You can ask questions.
Guys, before you ask questions, James George currently is practicing and is the practice owner for Excel Rehab and Wellness. It's physical therapy, homeopathic based practiced in Redlands, California. So thank you, James, for actually presenting this. It's an interesting topic. Actually, you covered so many information. So keep your slide on, because if somebody has any questions, we can go back to your slides and, we can go from there. So I think a lot of people will have more questions. So I'm going to leave it to them. So I'm going to wait for the questions to come in. Guys, and Dr. George's email address, I've sent it to everybody, and his contact information, I've send it on there. So if you have any questions, he also does telehealth. So if you have any questions or anything, just give him a call. So I'm going to leave it to him. I'm going to mute from my side, and then we'll go from there.
Great job, Dr. George. I got to get back to work. Thank you for what you did today. I appreciate it. This guy is top notch. He's worked on my back and my shoulder 3 times, and he's the best. He really is. So thank you, Dr. George. Everybody have a blessed day.
Yeah. Well, I've been
quick
so
question,
clear, I
this is
think.
Jay. Hey,
Yeah.
hey, thank you, doctor. And I have one quick question. So you said the inflammation is one of the things that we wanted to avoid, right? Is there any good herbs or fruit that we should take?
Yes. So if you look at all of these, the lists which I put here, they all brings down your inflammation and improve your immune function. Especially here, if you look at the herbs, the spices, the ginger, garlic, turmeric, cardamom, all those spices and the herbs will be helpful. Which typical, yeah. Adding those in your, I would say, make soups out of it. Add them, make a vegetable soup, add these spices and herbs, and make a soup. Like in southern India, there is a term called rasam. There is a soup called rasam. It's a vegetable soup that is really good to help improve your immune function, and it actually decreases your inflammation. You can Google rasam, RASAM.
Yep. So another question. This is the season for allergies through pollen and everything. And they have the same symptoms, kind of like your nose is leaking and the eyes irritated and throat itching and similar symptoms. And sometimes if it combined with fever, you're panicking whether it's the virus or not. So is there any way to know that that it could be allergy and not really the fever?
Yeah, typically allergies don't have fever. So if you some people can start with allergies, but if their immune system is, as I said, the immune response, I said, I gave a scale 1 to 10 when the immune system is low, scale of 1 to 3, and they have on top of that, if they have got infection that could cause. So if you have fever, for sure that is an infection, right? And if you do not have fever, but you have runny nose and sneezing, so the viral infection typically there won't be like a typical thing is sneezing. Allergies, you have sneezing, all right? And allergies would have running nose. And with COVID-19, they say it's very rare to have running nose, but you have dry cough. That's the differentiating factor. And
James, can you go back to that immune slide where you were talking about the immunity scale? Because I think that'll be a very good information to relearn again. Yeah. because it's like something that we don't see often in allopathy medicine. So yeah, can we go over? I think
Yeah,
that
so-
this will help along with differentiating the facts that Jayakantan was asking. I think you can compare both and,
So if you give a scale of 1 to 10, I'm putting 1 to 10 for you guys to understand easily. So 1 to 3 is low immune function, right? You're more prone for infection, more prone for cancer, and people who are on immunosuppressive drugs, all right? People who have had transplant, organ transplant, and I would put them in this scale, 1 to 3. What
Okay.
we need is 4 to 7, optimal immune function. You don't want to have 1 to 3. You don't want to have 8 to 10 as well. 8 to 10 is people end up having anaphylactic shock. You need an EpiPen. You need to be carrying it around all the time, right? So and 8 to 10 is you get exposed to something like pollens. You eat something, certain foods, your body doesn't like it. Your immune system is hyperactive.
So what do we do, James, basically to bring the hyperactive to see? The thing is the low immune, we have a lot of things. So what are the options that we have to bring from an hyperactive immune function to an optimal function?
Yes. So all these let me see the slide in 17
Okay.
can help modulate it. These are also immune modulators. Vitamin C is an immune modulator. Vitamin D is a strong immune modulator. Vitamin A. But what I have found, even I have had a lot of allergies growing up, and homeopathy has helped me. That's why I have a doctorate in physical therapy, and the reason I have studied homeopathy is I want to treat myself because I wanted to help myself, and that has helped me. Now I'm not allergic to anything, so I'm not saying these ones are very important, but I have found to a certain extent all these have helped to modulate my immune system, but homeopathy has helped to really well. So that is why I actually tell people to try homeopathy. I have had the great opportunity to work with people people with like the ulcerative colitis. I was just about to say ulcerative colitis, which is like the immune system is hyperactive, and I was able to help this person, and I was able to help people with the severe allergies, with anaphylactic shock, like peanut allergies. Homeopathy has helped, but I also recommend these ones. So homeopathy is found to even help go into the root of your genes, to keep your genes the bad genes keep shut down and keep your good genes working. We cannot remove our genes from our body. The genes what we are born with, it is going to be there, but we can keep those bad genes shut down with these nutrigenomics and with homeopathy. And these bad genes are the ones which are carriers of our gene expression of allergies and the anaphylactic shock and even low immune system. And we know by research people carry the cancer genes. We know that, and actually we have research in homeopathy that it can even root out that tendency to have cancer.
Excellent. Jayakantan, I'm sorry I came in between and talked. So I hope Dr. James
Yeah,
has
it
already
answered.
Okay.
Thanks, Ram. Thank you.
Thank you. And I think Manikanta Prasad has a question, James.
Sure.
So he was raising his hand. So, hey, unmute, Mani. Can you please unmute yourself?
Yeah,
Okay.
Can you hear me now?
Yeah, now I can hear you. So yeah.
Yeah. Thank you, James, for the presentation. It was really good. I just wanted to ask things regarding sleep. You said that melatonin can definitely improve your sleep. Is there any foods that we can take in the evening or something that can help us calm down? Do you think any hot drinks will be helpful? Because that's what we hear from our parents, that drink some hot stuff like kashayam or something. That
Like
can
milk.
help you.
Well, yeah, there are, there are Ayurvedic kashayams which can help. I'm not a specialist in that, so when I don't know something, I say I don't know. It's good to say what I know. Yes, what I would suggest
What is
you could
your
consult.
suggestion on foods that we can eat for a good sleep?
Well, typically you're having nuts at night. Nuts loaded with magnesium is known to help. Warm milk is known to help, but some people are allergic to milk. So it's all about. Remember, I told you you need to look at what you're allergic to as well. If you're allergic to certain nuts, you shouldn't be consuming those ones. And also bananas. Again, if you have a diagnosis of diabetes, bananas have like a lot of
Mm.
carbs in it. But bananas, if you don't have diabetes, bananas, if you eat bananas before you go to sleep, it's known, it has potassium. It is known to help go to sleep better.
Okay.
And many fruits, many people sometimes they are not able to go to sleep because they tend to be hypoglycemic. And having some fruits also like 2 or 3 hours before. Many of the fruits have potassium and magnesium in it, and nuts have magnesium in it. They are known to help you to go to sleep better.
Okay. Thank you.
But if you have diabetes, you got to be careful with eating fruits at night.
Okay.
The next person who has a question is, I think it's Gladstone. Gladstone, you can ask your question, sir. Just unmute yourself, Gladstone. James, 1 minute. Let me see where he is. Okay. Yeah. Gladstone, yeah, you're unmuted now.
Hello.
Yes, I can hear you.
Hey guys, good to see you, James. Good to see all of you. I have one question, James. You spoke about sleep, right? People who have problem to sleep and so on. So does smoking weed? I mean, I heard that weed is good for to make your body relax and sleep. So does weed help in any way for sleeping?
Okay. I'm not an expert in that. That's why I didn't put that in my slide.
Okay.
CBDs,
CBD, yeah.
those
CBD.
chemicals. I have studied in functional medicine. We call it cannabinoids.
Okay.
There are certain ones, over-the-counter ones. What you need to be very careful is it shouldn't have THC in it, right? The THC is known to cause you to be addicted. If you can find some, again, I don't know the state where you're from, whether it is legal. So again, I would suggest going to a health food store. There are many health food stores now. They are selling over the counter.
CBD, yeah.
So the cannabinoids are found to help with a lot of neurological issues as well. But now the thing with that is you need to be on it again and again to be helpful. So it is what I have found is food is the best thing, because food you always eat. And again, homeopathy, you don't need to be on it forever. You take it and it resets your body and it helps heal you. But cannabinoids are found to help improve sleep. Yes, yes, there are a lot of over-the-counter ones they sell in health food stores. Yeah.
I think that's an important slide, James, because our immunity, other than fruit and food, I think sleep plays an important factor.
Yeah, typically,
Yeah.
our Indian culture, many of us are from India. We tend to be late night sleepers, we are up till 12. And let me tell you something. There's very good research we have done. I have in functional medicine that anybody who can sleep before 11 o'clock, their organs function better. Especially your cortisol hormone is normalized. Your adrenals function well, your brain functions well, your liver functions well. If you can try to go to sleep before 11 and wake up at 6 o'clock, you got your 7 hours sleep.
Okay.
Thanks, James.
Okay, James. I have one more question, James, before I leave. And I heard from one of my friends that something called as L-arginine. It's
Yes.
kind of good to keep
Yes.
your immune system high. So
So it is a protein. Basically, if you look at the food I mentioned, fish, all these. When you take all these food, they have the food with like root vegetables. They have protein in it. So L-arginine and even NAC, N-acetyl carnitine, uh, alpha lipoic acid. Many of those can be helpful. Yeah, yes, but the food you eat, when you eat right, you get those from your food.
Like they say, food is your medicine. So
Eggs, yeah, all of those are helpful. But the reason I am putting here, especially these vegetables, when you chop them and keep them for a day or two, you have a lot of healing enzymes they produce. Yes, you can supplement with those. The reason I put probiotics is many times people eat yogurt. Yogurt has probiotics, but you can take probiotic supplements as well. Yes, L-arginine is very good. Yes, it's a protein. You can use that.
and the next question, Glad, can I, did he answer your question?
sure,
Okay.
man, sure.
Thanks,
Thank you,
Glad.
thank you.
Thank
Thank
you.
you.
And I think Ms. Ramona has a question for you, Dr. George.
Good afternoon, Dr. George. I do have a question. You mentioned that coconut oil is good to put like in the roof of your mouth to help break down the virus.
Mhm.
Is there any value also in maybe using like coconut oil on your hands after you wash your hands? Does that also help provide any protection?
Well, I do not have a research backup for that, but what I understand is we do use coconut oil. I mean, from my parents are from Kerala, where we use coconut oil like left and right for all cooking. We apply it on hair. We apply it
Right.
before taking shower and even after taking shower. So yeah, applying it on your hand. It actually it has a lot of nutrients which can keep your skin supple so that it doesn't dry up and break. Many people have, especially winter season. You wash your hands, and especially being in the medical field, if you're in the medical field, you wash your hands after every patient.
Exactly so much.
You're going to have chances of the chaps in the skin, and that could be a open entry for microbes to come in. So yes, applying coconut oil it is anti-inflammatory. We know that, so it helps heal. Yeah.
Okay, thank you.
Well,
And
Thanks, Ms. Ramona.
I was just going to ask if the slides were available. I was actually driving through. I heard it all. I couldn't see it all.
It is all available. It'll be available tomorrow on
Okay.
the Facebook page under Weekend Wellness.
Okay, thank
So,
you.
yeah, it should be there, man.
Okay.
I don't want to present it as a slide, but his presentation, Dr. George's presentation, will be there under Series 5.
Perfect. Okay.
Series 5. So
Thank you for doing this.
you're
thank
welcome.
you, Ms. Ramona, for joining us.
Tell it to your friends as well.
Yes, definitely. And I have a question. I think Ms. Ramona is done. Anyone else have any questions for Dr. George? Guys, I would take this opportunity once again to thank James for his time and his knowledge today. And basically, like I said, me and James, we know each other for a long time now. It's at least 23 years. And he started as a clinical instructor while I was doing my bachelor's in Ramchandra. And also, special fact is like he has started his practice in Redlands, California. If you guys have any questions on any of these foods and anything with homeopathy or anything, please contact him. I've already shared his phone number and and his email address. And also, our next topic tomorrow is women's health. Basically, Dr. Casey Smith is going to talk about pelvic floor exercise and everything. And please do log on. It'll be very informative. And we're going to, next week, our timing is going to change because our presenters are one of them is from London and another presenter is going to be from India. So definitely this won't be at 4 o'clock next week. I think Arun Kumar is going to present on Saturday. He's presenting at 3:30, and on EST. Once again, I'm saying all this in Eastern Standard Time. I'm not saying it in Pacific Time. So EST 3:30 next week, Arun Kumar. And then after that, Shyam Sundar is going to present. I have to confirm the timing because he's presenting from India. So I have to confirm the timing. With quarantine, with kids at home, it's not that easy to present. So in India, they're quarantined completely. They can't even get out. It's that easy. So I'm going to check with them on timing. I will confirm the time. Once again, please share with your friends. And if you have other good presenters who can give us good information, please share with them. They can also present on this. This is completely a free platform. And I wanted to use this time and opportunity to educate people. That's the only reason we are doing this. This is all healthcare professionals who are doing it. So please share the wealth. I mean, your information is your wealth. So please share it with your friends and families. And, if you have good presenters, please share their name. I'm more than happy to call them and have them as the presenters. So, we can go from there. Thank you once again, everybody, for logging on and listening to Dr. George. I hope it was very informative. And all this will be available tomorrow on or by tonight on Weekend Wellness page. Thank you, everybody. Thank you.
Thank you.